We are here at the opening commissioning of the 100 space unit bed facilities by Medicare Clinic Limited here in Otta area of Ogun State. I am Jennifer Ayimbofu, a correspondent of Eco Odd Blog, reporting live from the event. Here at the event of the commissioning, the management has made it known that this is the first phase of the commissioning of the hospital. Attending this event are high-end dignitaries, medical practitioners, and well-wishers. And you can trust on Eco Odd Blog to bring to you minute by minute of this event as it unfolds.
As part of the effort to checkmate medical tourism in the country, a 100-bed medical facility has been commissioned in East Medicare, Otta, Ogun State. The hospital management said it expected government collaboration by sending patients that could not be handled to the facility instead of going abroad. The hospital is to cater for antenatal, cardiology, diabetic, dental, hair, nose and throat, general surgery, hematology, immunization, and infant welfare.
When we had this crisis, I incurred a medical bill of 160,000. When I was about to be discharged, Dr. Okukoyi said I should not have a cover, that is part of his own contribution to the community. And then I went, not that alone, when I was going, he went to strong store there, he purchased a lot of, provisions, and went into the art shop. He got a very beautiful artwork, which...
Please permit me to stand on the existing protocol. I have the greatest honor and privilege to stand in today for the Alailua Oba Abdulkabir Adeyemi Ajani Oba Lanlege, the Otta of Otta, Lanlege Kotu. Well, the host himself has said it openly here. The reason why Otta cannot be here now, but he sent his goodwill message through me to the host. As a custodian of tradition and culture, he asked me to congratulate Dr. and Mrs. Kukoyi. He asked me to thank them. He also asked me to offer a traditional prayers for them. But before I do all these things, I want to let everybody here today to know that Dr. Kukoyi is a friend of Otta people. He's even a lover of our holy people in general and Otta in particular.
Jehovah Rapha is the Lord that healeth our diseases. Jehovah Nissi is our banner, is our victor. When you are in a battle, you need someone to fight for you. and you need some extra strength to win that battle. I pray for someone here. As many as are passing through any battle, God will fight on your behalf. And because you are not saying amen, I will say it myself. God will fight all my battle. And no, I don't need it again. Because when I ask you, when I pray for you, I don't know. You are just laughing. You look beautiful. But I'm sure what you are passing through is beyond what you put on your face. Even in Nigeria today, we are in a battlefront. And only those who God fight for will survive. I pray, I'm sure my Bishop Akiola and his wife will even say amen. You go there, you may probably leave the place more sick. Because some of the medical practitioners see that work as doing you a favor. And so there are sometimes I ask, although my wife happens to be a retired nurse, sometimes when you get to the hospital, by the time you, either the doctor or mostly they are nurses, by the time they showcase their hostility to you, they dress you down with some choice abusive words.
Go the extra mile to get you back on your feet again. You don't have to be afraid now. We'll take your hand, well, go the extra mile to get you back on your feet. Excellence is our watchword. Ooh, we employ all the best innovations in Medicare.
The program had featured renowned resource persons from US, UK, India, South Africa, and local reputable institutions and individuals. Kukoyi noted that when the Medicare and Dental Council of Nigeria (MDCN) made CME mandatory for Nigerian doctors in 2001, is Medicare as one of the first few private institutions accredited as continuing professional development (CPD) providers, adding that by this time the hospital already had a robust platform for delivering CME units at no cost to the doctors. He explained that since the first accreditation by the National Postgraduate Medical College of Nigeria (NPMCN) in 2008 as a training center for family medicine, the hospital provided tutelage for almost 50 family medicine residents from Teaching Hospital, Federal Medical Center, and General Hospital in the Southwest.
Say a very big thank you to everyone. A very, very big thank you for your love, your commitment, your prayers, your contributions, your support, everything that you have done to help us to bring this vision to a reality. I cannot shake the hand of everybody, but I know that God Almighty, in His infinite mercies, will bless everybody. I wish to express my profound gratitude to God that has brought this dream to reality. I wish to express my profound gratitude to everyone, our distinguished guests on the high table. Our distinguished guests, we are very happy to have you in our midst. We love you, we appreciate you. We thank you for your precious time that you have given us to honor this occasion. I would like to express my gratitude to Senator Dada. Can you please put your hands together for Jesus? Anglican Diocese team, can you put your hands together for Jesus? My father in the Lord, Bishop Dr. Akiola, and his wonderful wife, can you please put your hands together for Jesus? We are grateful.
Commissioning of the first private teaching hospital, and that is ACE Medicare Clinic.
Thank you very much, ma'am. When I was coming, I was saying I should be the one celebrating, and I believe all the Rotarians here should also be celebrating. I've seen some parties in governors, I've seen members of the Rotary Club of Otta actually here. Many Rotarians who are here to actually celebrate a man of integrity, a man of passion. This is an example that the ideals we profess in Rotary works. Ideal of integrity, ideal of service. One O, one T, one A, another R, with a Y. That's a rosary.
The hospital has hosted a number of residents, medical students and nurses on elective posting from US, Canada, UK, Russia and Ukraine. A cohort blog interviewed some dignitaries and they have this to say.
Okay, his first daughter is my very good friend. We went to school together. We've been long-time friends, say for 19 years now. Yeah, so we go way back. Well, what would I say? Just as long as you can dream it, right? It will come to pass.
It is a humility personified. Because while all this one was going on, he did not even give us an inkling of it. We had no idea that he was having something like this, yet he was still doing what he was supposed to do. Now, it will strike you as a gentleman all through. Not even what you can say you saw when we were in school, but then he lived it all throughout. And I'm very proud of him. I'm very proud of him.
Well, I am a family friend. I'm also a shepherd to the family, and well, we've been close for years, and we thank God that the relationship is growing more and more, and we are seeing the glory of God. Thank you.
In a short way, how can you really describe who Dr. Kukoyi really is?
Dr. Kukoyi is a man who defies every word or every adjective you want to qualify him. He's godly, he's humane, he's a great giver, he's liberal, and his practice is also a practice, with finesse, with a touch of class. All right, and so it's very, very lovely, and so we thank God so much for him.
Honestly, I don't know the word to. Dr. Kukoyi is a wonderful man, a hard-kinded man, a good giver. He gives beyond measure. He's a good man, a wonderful man, a kind-hearted man. That's who Dr. Kukoyi is.
This is a real stepping stone, especially for our country. We hardly see stops like this going on in Nigeria. What advice do you have for the government as regards our health sector, looking at this standard that Dr. Kukoyi is setting out there?
Honestly, our government are not trying at all. When it's especially Ogun State, Otta in particular. I've been to the health center in Otta. It's nothing, and would employ our government to come and do more, because health is very, very crucial and important. So they should help us see to the well-being of people.
Well, our motivation and drive has always been excellence. Excellence is a goal. You have to strive every minute to achieve excellence. It's a continuous journey. You keep going on the journey until you achieve that excellence. And even when you achieve it, you still have to keep on to maintain the excellence.
Sir, how do you think that the government of today can help practitioners like you in order to improve the health service of this country?
Well, there are so many incentives that the government can do to encourage private practitioners. One of them is tax relief, which some countries do. That is, they don't tax the institutions until they start making profits. Other ones include making bank loans available at very, very reduced interest. In that way, they can promote private practices and enterprises like this.
This is an 100-unit hospital, I guess. Can you tell us in more details what the facility entails?
Well, apart from the radiological services and the laboratory services, we also intend to have theater suites that will attend to various specialties and subspecialties. We intend to have many intensive care rooms, which will take care of very critical illnesses, and we also want to have multi-specialist clinics and services.
Thank you very much, Dr. Kukoyi.
Sir, your mates have said a lot about you from your humble beginning back in secondary school days. Would you say that has been a motivating factor for you to achieve what you've achieved so far?
Well, I think so, but you know that humility is only people outside that can see that in you. But like I said earlier, the motivating thing has been to achieve excellence, and that is why our vision is to become and be a center of medical excellence.
Yeah, this is a new level. The quality of this building and the equipment inside the hospital, it shows that we are moving to what I refer to as digitalized office systems. We're moving away from analog systems. You can see how computerized the system is, and that's the way it is in the world. The hospital around the world now is taking this kind of standard, and this is a challenge to any other hospitals, especially federal government and state government hospitals. They have to move up and double their works.
What do you think that the government of today can do better to encourage people like Dr. Wole Kukoyi in the community?
What they need to do is to support him in most projects. They need to consult him, to add values to them, because the government system is working, but it can work better. You can compare the standards, compare it to government hospitals. When we know able to provide this kind of laws-related environment, but functionality is very key, and that's what they can learn from him.
Well, I was just, before you came now, I was discussing with somebody, and we were saying this has been an amazing work that Dr. Kukoyi has done. It is almost impossible for it to be said that it was one man who put this together. It has been a journey of many years, but for him to remain composed, calm, and in the spirit to deliver this project it is something that I can almost term not humanly possible. But he has done what is not humanly possible. I am extremely proud of him. Not too many people can boast or even think of putting this together. This 130-bed hospital is bigger than most of the teaching hospitals in Nigeria today. So you're actually sitting on the premises of a private teaching hospital. That is how massive this project is. It's fantastic. It is every doctor's dream. You know, he's a mentor to myself and many other doctors out there. So we're happy. We're proud to be associated with him, and I'm even prouder to be his son-in-law.
Yes, to the best of my knowledge, we have the theater ICU, we have the radiology department, we have the laboratory, we have the ophthalmology department, but my company covers the supply of equipment into the theater and ICU and the radiology department, where we have the CT scan in the radiology department, we have the X-ray units, we have the ultrasound machine, and to the ICU we have the infusion pump, syringe pump, we have the ventilators and operating table.
Can you say that of a true that this hospital, this facility is well equipped with the necessary equipment and hospital need to function properly?
Yes, I've been doing this for more than 30 years. So from experience, I can tell you, this Medicare, the current side that we are in, there's nothing you want to do as far as the healthcare is concerned that you will not get it here, you know, at the world class.
How do you feel about today's event?
Well, we give all glory to God. It has been a dream in the heart of my husband, and today it has become a reality. We thank God because over a period of time we have been putting things together to bring this dream to pass, but today it has been fulfilled. So I feel so happy, so joyful. It's the Lord's doing. Let me crown it as saying it's the Lord's doing, and it is marvelous in our sight.
The saying goes that behind every successful woman there is a woman. Behind every successful man there is a woman. What can you say about this?
Well, I want to encourage every woman behind your husband, pray a lot, pray him to fulfill his destiny, pray that he will become somebody great, pray that God Almighty will help him all the days of his life, and you will both enjoy the fruits of your labor together. God bless you.
Thank you very much.
Dr. Kukoyi had made a history, and the memories of his good deed will continue ringing in the mind of the Otta community and Nigeria at large.
We have come to the end of this event, and we have heard it from dignitaries who had come far and wide. They have a lot to say about the man who is the brain behind this facility that we are standing on right now, Dr. Wole Kukoyi. And it's of no doubt that this facility is set to serve its purpose to the Ogun State and the people of the Otta community in general. I am Jennifer Aibofu, reporting for a cohort blog.